All right, welcome back. This is Charles, your co-host. Today, here to talk about heart conditions. Number one, we are going to deal with hypertension. Hypertension. What is hypertension? Hypertension is a state of whereby you find the body has high blood pressures. That is high blood arterial pressures. So, for instance, for now, we can ask ourselves, when was the last time you checked your BP? When was the last time you went into a hospital, you went into a clinic and recorded your blood pressures? I know most of us assume that blood pressure measuring is not important, of which I consider it as a very, very, very important thing to do in the screening of hypertension. Number two, what are the risk factors of hypertension? Hypertension is a chronic disease whereby if you get hypertension today, you don't expect to be healed at once. You don't expect to be healed. It's a lifelong, it's a chronic condition that only we have to adjust our daily life. So it's one of the chronic conditions and non-communicable for that matter. Non-communicable diseases are the diseases that are not, infected from that, do not move from one person to another. They are non-infective in nature. So for hypertension, the risk factors, number one, we have genetic predisposition. For the genetic predisposition, it's whereby we find that one of the family members, maybe your parents, had hypertension. That the genes of hypertension, they are transmitted as how the genes are normally transmitted. You have some genes which can be transmitted to the siblings of mothers and of parents who had hypertension. That's one of the risk factors. Number two, living a sedentary lifestyle. What is that sedentary lifestyle? A lifestyle whereby you have physical inactivity. You don't practice, you don't do any outdoor games. You just maybe one of the risk factors of this inactivity is maybe the job that we are doing. Maybe your work is to just stay and in the office, and you don't have any other time for practicing or to keep you fit, and also to jog a little bit, to walk. Sometimes some of us have cars, so you have to use your car from work to home, from where to where. So sometimes even take a nap, take some few minutes to walk downstairs, take some few minutes to walk in the morning, few minutes in the morning to run, jog, do some yoga, do some exercises, so that we can enhance the physical activity. Another thing, the diet we are taking. Diet is a very essential part in our lifestyle. The diet that we are taking greatly affects our bodies. Number one, that is where we get our the body gets its raw materials to maintain its normal metabolism. So with taking poor diets, that's how you develop hypertension. For example, taking a lot of fats. A lot of fats are associated with atherosclerosis or sclerosis, whereby we find that the fat accumulate in the vessels, the blood vessels, that is arteries and veins. Hence, the lumen of the blood vessels, it becomes thinner and thinner. So if it was this size, it gets thinner and thinner, and this leads to increased pressure. The heart will have to pump a lot of pressure so that this blood can get in between the thin lumen of the blood pressure. So when you are taking a lot of fats, make sure you exercise more than enough. Make sure your diet has lavages, your diet has, you are taking a balanced diet, a diet that won't affect your health at the long last. Another thing, it's alcoholism. For those of us who use alcohol, alcoholism is directly associated with alcoholism, because when you have alcoholism, you overwork your livers, which the liver condition will bring to heart condition at the long last, with the renal conditions. Another risk factor is smoking. Smoking gives the heart a lot of chemical radicals that will go to the muscles of the heart and bring about changes that will lead to hypertension. So For today, that's what we have about hypertension. Follow us in the next video to do more and more about hypertension. Make sure you measure your blood pressure today. Make sure you get into a clinic, get into a hospital. Blood pressure measuring is very, very easy, and it's a free service. Unless otherwise, it's a free service for screening of hypertension and other cardiac diseases. So guys, remember to subscribe to my channel as we grow and grow. Also comment, like, and also subscribe as the last thing you should do. Thank you for your time and also listening and paying attention to what I'm saying. I don't take it for granted. I appreciate you guys very, very, very much. Be blessed.